Hi, my name is Grace and I'm going to be your nurse today. I would walk in and perform hand hygiene, and then I would do a quick Q-SIN of the room. I would check for any obstacles around the bed and in line to the bathroom. He has 3 side rails up, his bed alarm is on, and his call light is within reach. The only tubes he has in right now is an IV in his right hand, because we're going to be giving him some antihypertensive meds later on. And then I'm going to get started, so I would do hand hygiene. So my name is Grace, I'm going to be your nurse today, and I'm going to do a quick head-to-toe assessment, get your vitals. So since this patient is a 4-year-old child, I'm going to be asking most of the questions to the parents. So I'm going to do his vitals real quick. I'm going to get your temperature. Can you open up for me? And I'm going to put this underneath your tongue. And it is 98.8. I'm going to check his pulses. And it is 84, and it is regular. And his respiratory rate is 17. It's regular and he is a little shallow. I'm going to now check his blood pressure on his right arm. And it is 154/92. And that's his left arm. I said right, but I meant left. And which is high for him, but it is expected of his nephrotic syndrome. And I'm going to check his pulse ox, and it is 98% on room air. And okay, I would ask him if he's having any pain anywhere, and I would chart any pain he's having. He does have, just looking at him, he has a swelling in his arms and legs and a little bit in his face, and he also has swelling in his stomach. So I'm going to continue on with the assessment, and I'd be like, can you tell me your name? And do you know where we're at right now? And do you know what the day of the week it is? Okay, and his speech is clear. And I would check his eyes. Can you look straight ahead for me? Pupils are equal and reactive bilaterally. All right, can you squeeze my fingers for me? Can you push against my hands? Pull back. All right. I would check his JVD, laying down and standing up. He doesn't have any JVD. Okay, I'm gonna listen to your lungs. So every time my stethoscope, this thing touches you, will you take a deep breath in and out for me? All right, now I'm going to check your lung sounds on your back, so you can go ahead and turn for me. His lung sounds are clear. He's not short of breath, and as I've been in here, he hasn't had any cough, but I would ask his parents if he's been experiencing a cough. And I'm going to check his apical pulse for a full minute. All right, now I'm going to listen to your heart. So it is regular, and S1 and S2 are present. All right, I'm going to check his cap refill. It's less than 3 seconds, and all his fingertips. His radial pulses are present bilaterally. He does have edema here and is not pitting. And can you move your fingers for me? Okay. Do you know what finger I'm touching? And then I would ask him if he's having any numbness in his fingers or tingling. And does it hurt anywhere in your fingers or your arms? And then I'm going to check out his stomach. I would see that he has ascites. And so I'm going to listen first. So I'm going to take a listen on your stomach. His bowel sounds are active, times 4 quadrants. I'm going to feel. So it is a little firm due to the ascites. And I would ask his parents his last bowel movement that they know of, and if he's been passing gas and belching, and if he's had any constipation, diarrhea, nausea, or vomiting. And then I can tell that he is continent, and I would ask his parents how his urine has been looking, and based on his diagnosis, his urine would probably be foamy and yellow due to the massive amount of proteins in his urine. And I would ask if there's been any frequency, urgency, burning, or discharge. And then I can tell from his skin that it is pink, and his swelling, extremities are a little cool, but he is dry. So now I'm going to check out his feet. I would check his calf refill on his toes. Can you push against my hands? Can you pull back? His pedal pulses are present. He has edema in his feet and his legs, non-pitting. And can you wiggle your toes for me? And can you tell me what toe I'm touching? Okay. And then I would check out his IV site. After I touched his toes and stuff, I would get new gloves and perform hand hygiene. And I would check for redness, any edema or warmth to the site, and there seems to be none. So that's good. So I'm going to turn the TV on for him so he has something to entertain himself. And here's your call light. Let me know if you need anything. I'm going to go tell the doctor what's going on, and then I will be back. So, hi guys, I'm back. So I would perform hand hygiene and put on some gloves. The doctor wants to get a weight and height. So we did that, and his weight was 40 pounds, and his height was 43 inches. So his weight is a little increased, and his parents would ask me about his diet, and due to his nephrotic syndrome, he would most likely have to be put on sodium restriction and protein restriction due to the hyperlipidemia and the massive amount of protein in his urine. Also, due to his edema and swelling, he would be on fluid restriction. So the best thing for his, for food to eat would be lean meats, fresh fruits such as apples or bananas, low salted snacks, maybe some beans, and I would educate her on that. And then the doctor has ordered a antihypertensive medication since his blood pressure was 154/92. So I'm going to go get that, and I'm going to put it into his IV. So I will be right back. Hi, so I'm back, and I have brought the antihypertensive med, and I would perform hand hygiene, put some gloves on, and it is labutal, and the doctor has ordered 0.5 milligrams per kilogram, and the labutal solution is 5 milligrams per milliliter. So after doing the math with his weight, I'm going to be giving 8.8 milliliters IV push. So I have drawn up the medication and I have my flush. I would ask him his name and date of birth and scan his bracelet as well, or ask his parents. And I would ask for any allergies, and I would check the site for any redness or swelling or infiltration. And at first I'm going to flush the site. And then I'm going to administer the 8.8 milliliters of labuterol. And I wouldn't push it all at once. I would do it over a course of 30 seconds to a minute. And then when that's done, I would flush it again. And then I would cap it, and I would go and document everything. And I would come back in a half an hour to an hour or so and check his blood pressure to make sure that has gone down. And due to the patient's nephrotic syndrome, I would expect the doctor to order diuretics to get some of his fluid off of him due to his ascites and swelling in his arms and legs. I would also expect maybe some Lipitor and other statin med due to his maybe hyperlipidemia, and a steroid to decrease his inflammation of his nephrotic syndrome. And his parents asked me how we will know if his treatment is working. And with the antihypertensive med, we will see a decrease in his blood pressure to normal limit. He will be his labs and urine will be regularly monitored for to see if the protein has gone down in his urine with a urine analysis, and his vitals and assessment will be monitored regularly to make sure to see if his edema has gotten worse or if it has gone down due to the medications. Also, we would check his labs to make sure his blood cholesterol level is going down as well. And if his edema is going down, that means his albumin is going back up, and that means that it is working properly. And we would also assess for complications of nephrotic syndrome, such as a blood clots in the body and a pulmonary embolism. And if none of those complications occur, then that means that the treatment is working and he is right on track. Hi, I'm back. So you're going to be getting a new nurse today, so I'm going to do a quick report after her and let her know what's going on. So this is a 4-year-old boy. He came in with his parents and with nephrotic syndrome, and he had ascites and swelling of his arms and legs. I did a quick head-to-toe assessment on him, and he had hypertension, which was expected, and his urine showed a massive amount of protein in it. So we gave him labuterol IV push, 8.8 milliliters, and that has seemed to be working. His blood pressure has gone down. So the course of treatment is to continue monitoring his urine and his labs, and to assess for swelling, and also to assess for the complications of nephrotic syndrome. His parents have also been taught the restrictions of the diet, such as fluid restrictions and sodium and protein restrictions. And so far he has been doing good.